Okay. Hello, everyone. Can you hear me at the back? I take the thumbs up. That's good. My name's Graham Watt. I'm a member of council. It's a pleasure to welcome you to this final lecture of 2025, the 6th lecture in the 224th session of the Royal Philosophical Society of Glasgow. Some housekeeping for those who are new or perhaps those who've forgotten. The toilets are in the basement, the disabled toilets by the door as you come in. The fire exits are the way you came in and where you see them. No fire alarms are planned. If your phone is set to go off or could go off, please remember to turn it off. So tonight's lecture. The rich man in his castle, the poor man at his gate, God made them high and lowly and ordered their estate. Verse 3 of all things bright and beautiful. Other explanations of social order are available, as we'll hear in this evening's lecture. In his book, A Century of the Scottish People, T.C. Smout, a professor at St Andrews, wrote that the true grimness of the Scottish town was concealed from the tourist round of monuments and shopping centres and was only revealed by the patient statistics of the Registrar General. Inequalities in health is an abstract term. It requires a comparison to be made between social groups, none of which may be aware of each other's experience. And for that, we need people who are able to locate the data, not just mortality data, but the many other sources of data in which Scotland is rich, in order to make these comparisons, to find differences, to explain them, and to present them to whoever is interested, especially people in a position to do something about it. The challenge is not just to entertain people with information about inequalities, but to lead to change. So this evening we're in the very capable hands of David Walsh, who for almost 2 decades was a stalwart of the Glasgow Centre for Population Health, but in the last couple of years has become a senior lecturer at the University of Glasgow. David.
Can you hear me okay? Yeah. Well, thanks to the organisers for the invitation. Thanks to you for all coming out on a fairly dismal December evening. Thanks to Graham for the nice introduction. I'm sure he used the word entertainment there. As you can see from the title of the talk, this is going to be a hugely entertaining, uplifting session. I'm entirely expecting people to be leaving with a smile on their face, a spinning in their step, and just a general feeling of kind of festive warmth and happiness. Or maybe not. So I'm going to be talking about health inequalities, as Graham has alluded to, and I'm going to be doing it from a kind of then and now perspective, and the then will be a historical look back, not just over decades, but actually over well over a century. And the now will be to try and bring back into focus what's happened in the last 15 years, because what's happened to health inequalities in the last 15 years, I think, has been pretty staggering, and I think a lot of people aren't really aware of the scale of what's happened. And for that second part, and as the bump about the talk made clear, I'm going to use stuff that we included in a book that we published almost exactly a year ago. The book also has a very uplifting, chirpy, cheery title, as you can see there, and I'll explain and justify that later on. And this is actually quite important for me personally, because as Graham's alluded to, I've spent decades in working in public health, but in the NHS, but I'm now in the university, in academia. So having this book means I can do that really pompous academic thing of tossing back what's left of my hair and saying, as we wrote in our book. And I'm going to do that throughout the talk because I really like kind of academic pomposity. Anyway, as the subtitle of the book and the title of the whole talk makes clear, the underlying theme of everything I'm going to talk about is understanding the importance of political factors in shaping the health of populations. And that's really important to understand anyway, but especially when it comes to what do you do about it? What are the solutions, the political responses that are required? I'm going to romp through this at a reasonably good pace, and that's because although I've promised you a festive feeling of warmth and goodness, it is possible we might dip into quite depressing things. And so rather than kind of languishing on them, I'm going to move on at a pretty sprightly pace. So, I don't know, keep up when I start speeding up. Just before we get into the meat of the presentation, there's a couple of sort of dull definitional explanatory issues I just want to get out of the way. They're dull, but they're brief and also quite important in terms of being context for what I'm going to talk about. And sincere apologies to those in the audience who know all this. Many of you will do. But I find this quite a helpful sort of question prevention strategy, if you like, just to get some of the stuff out of the way at the beginning. So first of all, we're talking about health inequalities, and I'm not going to insult your intelligence by asking what they are, because you all intuitively know what health inequalities are. But it is just worth being aware that there's lots of different definitions of them. And in part, that's because academics love nothing more than just churning out really tedious journal papers with lots of definitional aspects in them. For the purposes of tonight, I'll use a definition by my colleague, Jerry McCartney, who's also the co-author of our book. And he defined them as being systematic, avoidable, and this is the important word, unfair differences in health between populations or between groups in a population. So the unfair differences between rich and poor, as Graham was alluding to, the unfair differences in health between ethnic groups, for example. And as we're talking about health inequalities, you have to be aware there's lots of different ways of looking at health, from mental health, physical health, all the way up to kind of the summary population health indicators that, again, that Graham mentioned, like mortality and life expectancy. And more importantly than that, there's lots and lots of different aspects of inequality. So I've talked about already about socioeconomic inequalities, the unfair differences between rich and poor, ethnic inequalities, but you also get inequalities by geography, by age, by gender, by disability, etc. And a lot of these things overlap, or to use the buzzword, intersect. So you get this intersectionality, which is kind of multiple disadvantage in relation to health. For the reasons of manageability and time, i.e. I don't want to do a PowerPoint presentation for 14 hours. I'm just going to talk about those kind of summary population health measures, mortality and life expectancy, and they're good measures, so I think that's justifiable. And I'm largely going to talk about socioeconomic inequalities in those measures. And again, that's for reasons of time, but it's not to downplay the importance of the other inequalities. And the second quick thing to say before we start is just about understanding the impact of these socioeconomic factors on health and socioeconomic gradients in health. And the main thing to remember is that at the bottom of any socioeconomic gradient is you have poverty. And without pointing out the bleeding obvious, poverty is very, 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 very bad for your health. Poverty basically kills. And it's important to understand how poverty impacts on your health, again, because it's relevant to what I'm going to talk about later on. So first of all, it's about whether you can afford health protecting things in your life. So being able to pay the rent so you don't end up homeless, being able to heat your home so you're living in a warm, healthy house, being able to afford healthier food because it's more expensive than unhealthy food. And poverty is also a relative thing, so it's about being able to participate fully in society. And if you can't do that, and you can't put food on the table for your kids, and you can't pay the bills, then obviously it's horribly, horribly stressful, and stress is a well-established risk factor for lots of diseases. So basically, poverty makes you very, very ill. It also impacts on your mental health, and the important thing about that is there's very solid links between poor mental health and poor physical health. So if you suffer from particular mental health issues, you're at greater risk of physical health issues, and that's because of some of the same biological-related, stress-related causal pathways. Another thing is that human beings' response to stress and misery is to try and kind of numb the pain with different so-called coping mechanisms. And that can range from a bit of comfort eating through not being able to give up smoking through to really kind of harmful drug, alcohol use. And that's why in poorer areas where there's a lot more stress, you get much higher levels of issues around alcohol and drugs. So poverty is really, really bad for you. In the unlikely event that your GP offers you this prescription, seriously take it. It'll be really, really good for your health. And coming back to the gradient, a really simple way of thinking about this gradient is that every step away from poverty is better for your health. And that's why you get these extraordinary social gradients in this country. This is randomly picked from a website the other day. It's hospital admissions for COPD, from the poorest to the least poor, the least deprived. And you see exactly the same things for just about any condition you want to look at. This is deaths from COVID just a few years ago in Glasgow. And COVID's a really good example of this, actually, because diseases change over time. They come and go, new diseases appear, others become less important in their frequency. But if you are in an unequal society, it doesn't really matter what the disease of the day is. You'll always have health inequalities in that disease. You'll always have inequalities in that disease. And if society becomes more unequal, then health inequalities will widen as a consequence. And again, this is important for what I'm going to talk about tonight. So I haven't even really started the lecture, and we're already kind of touching on quite depressing things. So let's move on very rapidly to the first part of the talk, which is about looking back historically at health inequalities. And the first slide I have in terms of introducing this is actually quite an old slide, and I've used it with students for quite a long time. And I used to ask them, especially if there was international students in the audience, I would ask them, what do you think of when you think of health in Scotland? And I was trying to get them to think about inequalities and structural things. But I stopped doing it because every single time I did it, somebody shouted out, deep fried Mars bars, which was not really where I was trying to go with it. And as you know, deep fried Mars bars are only really eaten by tourists or English journalists who like to come up and make disparaging comments about Scotland. So instead, what I tend to say is that if you work in public health, one of the things you think about in terms of Scotland's health is headlines like this, the sick man of Europe. This is a frequently used headline in the Scottish media. If you don't believe me, there you go. And one of the interesting things about it, I think, is that unlike just about anything else you read in the Scottish media, especially in open inverted commas newspapers like the one at the top, is that it is actually true in the sense that if you look at these summary measures of population health, like life expectancy, then as I'm sure everybody in this room knows, Scotland lags behind every other Western European country, and that's true for both for males and for females. What you may or may not be so familiar with or aware of is that part of the explanation lies with a much slower rate of improvement over time. So this next chart shows long-term trends in male and female life expectancy going all the way back to the middle of the 19th century, more or less up to the present day, just before COVID hit. And every line is one of the major Western European countries, so Germany, Spain, France, England, whatever. And if I just highlight the trend for Scotland, the two important things to note are, as the slide said a second ago, Scotland's not always been in this position of having lower life expectancy than elsewhere. From about the middle of the 19th to about the middle of the 20th century, we were kind of in the middle of the pack. But then what happened over the next 6 or 7 decades is that although that generally things continued to improve, they improved more slowly, meaning that by the end of the period, we were in this position of having lower life expectancy than elsewhere. Now, 3 quick things to note about this. First, clearly the gap in life expectancy now is much narrower than it was, say, 50 or certainly 100 years ago. So does this matter? But the answer to that is it matters massively, because a gap of whatever that is, 3 or 4 years at the level of whole countries, equates to a difference of thousands and thousands of deaths. So this is hugely, hugely significant. The second thing to note is this weird kind of change in life expectancy in the most recent period. I'm going to pick that up in the second half of the talk. And the third thing to note is that this divergence of Scotland from the other countries, this falling away, has been particularly acute since the start of the 1980s, or to be more politically accurate, from about 1979. And for those not laughing knowingly, I'll explain the significance of that just in a wee second. But the main point to take from those charts in terms of understanding these national trends is that the main reason life expectancy is low in Scotland is because inequalities in life expectancy are so wide. So the gap between rich and poor is much, much wider here. And if you think about it, that pulls down the overall average. And I can throw lots of stats at you to show that Scotland has the widest health inequalities in Western Europe. This is a particular measure. Don't worry about the technical definition of it. It's called lifespan variation. But the bottom line is we can arguably use it as a proxy for socioeconomic inequalities in life expectancy. So there's a gap between rich and poor in life expectancy. And if we do that, you see that Scotland stands out. Notable also that other parts of the UK are also at the high end of the spectrum. And of course, within Scotland, you've all seen further examples of this social gradient. This is a 13-year gap in life expectancy between the poorest and the best off in Scotland. And of course, in this city, you can show even more scandalous and depressing statistics, like an 18-year gap between neighbourhoods of Glasgow that are only 2 or 3 miles apart spatially. So inequalities are massively wide here, and they widened, and this is the important point, considerably in that period that I highlighted on the chart from about 1979 onwards. So if we go back to this measure of lifespan variation, this proxy for inequalities in life expectancy, then again, we can look at the same countries over the same long-term period back to the 19th century. Back in the middle of the 19th century, we were quite busy throwing children up chimneys. Child mortality was very high, therefore, a lot of poor people died from infectious diseases. As living conditions are more improved, then obviously inequalities fell massively over time, and that's also the case in Scotland. But by the time we get all the way through to the 1980s, Scotland then completely bucks that downward trend, with inequalities widening, both in a relative sense, but also in an absolute sense. Why did that happen? Well, it happened because this was a period that society, and by that I mean Scottish society, but also wider British society, fundamentally changed. It became a fundamentally different place, a fundamentally more unequal place. So if we look at a measure of not health inequality yet, but societal inequality, socioeconomic inequality, we can use something like income inequality as a proxy for broader societal inequality. And if we use this, we can go back to about the 1960s. And in the 1960s, this jumped about an awful lot. But the important point is, in a European sense, this was very low. So Britain was a very equal place back in the 1960s. But then from about 1979, there's just the most extraordinary change. And we've never gone back from that. And it's taken us to the place where Britain is by far the most unequal place in Western Europe. Why did that happen? So there she is. So Thatcher's become a bit of a trope. If the younger members of the audience, and I'm sure I saw one maybe up the top there, will know that there's a comic called Limmy, and Limmy has a whole sketch about Thatcher. It's about 45 years since she was in power, but you still see people wearing anti-Thatcher t-shirts. And any visitors to a new path near Sight Hill might be slightly confused by one of the sponsors of that particular. And every Tory bastard. So it's become a bit of a trope, but it's also true, because what happened in that period was policies were introduced that massively widened societal inequalities. They were very favourable towards the rich, and they were not, to say the least, favourable towards the poor. Poverty increased. That social gradient that we talked about also increased. And we can see this in greater time context, if you like, by using a different measure. This is a measure of the share of the income from the top 1%, again as a proxy for just broader societal inequalities. And this allows us to go all the way back to the 1920s. In the 1920s, Britain was a hugely unequal place. Over time, it became a more and more equal place until about 1979, when it became a much more unequal place again. And because of this social gradient and the social gradient impact on health, because of the link between poverty and poor health, income and health, wealth and health, if you look at trends in health inequalities in that time, they basically do the same thing. So as Britain was becoming a more equal place, mortality inequalities, this is the gap between the best and the worst areas, were coming down. As Britain became a much more unequal place, health inequalities also worsened. And they worsened to the point that round about the last time period in this chart was a period when the World Health Organization brought out a report. It was a kind of landmark report on health inequalities. And in that report, they showed at the time a staggering 28-year gap in life expectancy, again between neighbourhoods of this city that only lie a few miles apart. Now, two quick things to say about this. First is, don't ever use these data or quote these data. They're massively out of date, and I'm only including them as part of this historical look back. And the second thing to say is, you can argue that this is one of the fundamentally stupidest tables ever included in any kind of health report, because what they're doing here is comparing life expectancy in really small areas, about 3,000 or 4,000 people, with entire countries. So America, what's that, 500 million people? India, 1.4 billion people. But in the World Health Organization's defense, what they were trying to do was illustrate the scale of inequalities, both between countries, but also within countries. And it's very telling, I think, that they use data from the UK at this time, and not even just the UK, from Scotland at this time, to illustrate this. And there's a kind of famous quote, or a famous in our worlds, in this quote in the report. It says, "It does not have to be this way, and it's not right that it should be like this. Social injustice is killing people on a grand scale." Killing people on a grand scale. It's a very powerful sentiment. It's a very powerful quote. At the same time, though, there was a political economist, I think there still is a political economist, called Vicente Navarro, and he retorted in a paper. He said, "It's not inequalities that kill people, as the report states. It is those who are responsible for the inequalities who kill people." So it's the people making the decisions, the political decisions, the economic decisions that is impacting on people's lives who are responsible. And the second part of the talk I want to talk about goes into this in a little bit more clearer detail. Just before I get there, I just want to quickly summarise what I've said so far, because I'm romping through quite a lot of information. But in essence, life expectancy in Scotland is very low, lower than elsewhere in Western Europe. That is linked to slower improvement over a period of time in which inequalities, the gap between rich and poor, was widening to the point where we have the very widest, and that pulls down that overall average, and that was driven by widening societal inequalities that was caused by government policies. Hence, the title of this talk is about rotten politics. However, the more observant among you, or to put it another way, anyone who's still awake out there, may have noticed a discrepancy in the sense that everything I've talked about in terms of widening societal and health inequalities has been about the UK as a whole, but I also said that health inequalities were wider in Scotland. And the reason for that is basically additional rotten politics have been implemented in Scotland, which has further widened health inequalities. I'm not going to get into this tonight because it's another 45-minute PowerPoint presentation, and trust me, you don't want another 45 minutes of PowerPoint tonight. But in essence, we brought out a report almost 10 years ago. It's 350 pages long. If there's anyone in your family you hate and you're looking for a Christmas present for them, I recommend it. But in essence, there was a whole load of actions by local government and UK government in the post-war period through to the 70s, 80s and 90s, which basically had an adverse effect on Scotland and particularly in and around Glasgow, and widened inequalities further. If you're interested, drop me an email and I can send you a link to a kind of a very short summary video of what happened. So to throw that into the mix, therefore, in terms of this kind of explanation for low life expectancy, wide inequalities, I've kind of explained why we're there now. And if this was 15 years ago, having done that, I could have ended the talk now, and we could have gone for an early cup of tea or a glass of wine, and we could have had conversations along the lines of, Thatcher, see that Thatcher. But actually, what's happened in the last 15 years, I think, outdoes anything that was done at the time of Mrs. Thatcher, because things have changed profoundly, and we are now in a new era of health inequalities, and I don't really mean that in a good way. So I'm talking about the now, what's been happening recently, and it relates in part, well, not in part, in large part, to what you saw earlier with this weird change in life expectancy in the most recent period in Scotland, and also what we covered in the book we wrote. So the background to this actually lies with headlines that were appearing prior to the pandemic that was talking about a stalling of improvement in life expectancy, both in Scotland, but also in the UK. A stalling of improvement. I'm pretty confident in saying that for most people who saw those headlines, they would have absolutely no idea what that really meant. And even if they read the detail of the articles, which was saying that life expectancy was now no longer going up quite as fast as it was before, probably thought, okay, who cares? That doesn't sound very interesting. But if you are working in public health, this was ringing all sorts of alarm bells for a very simple reason, that in a rich society, be that Scotland, be that the UK, this should not happen. This should never happen. Life expectancy should still be going up, and mortality rates, which show the same information but in the opposite direction, they come down as people live longer. Mortality rates should still be coming down. So it prompted lots of people to start looking at the data, and what has emerged from the data is, I think, pretty horribly concerning. So I'm going to start with England, and I do this deliberately because this is not a Scottish-specific story, it's a UK-wide story. And these are mortality rates for females, but it's the same for males. And this is the long-term improvement. So people living longer over time. And this goes back to the 1980s, but you could take this back further and further and further up the wall in the same way as those other charts went back further. And then in the early 2010s, you see this so-called stalling of improvement, this leveling off, this kind of flatlining. What's really important to understand about this is that, funnily enough, this isn't about the rich in society. If you look at death rates for people living in the wealthy parts of England, these are the 20% least deprived, but the wealthier parts, there's a slight change in the trend, but importantly, death rates continue to come down, meaning that people are still living longer on average. But it's very, very, very much about those living in the most deprived areas, where barely believably, really, death rates stopped coming down and actually started to go into reverse, meaning that people were no longer living longer on average, but actually dying younger. In a country as rich as England, man, this should never happen, like never, never happen. And it's important to emphasize, this isn't the 1% poorest population or the 2%. This is a fifth of the whole population of England. The picture in Scotland is exactly the same. Death rates in the 20% most deprived areas stopped coming down and started to go up, a widening of inequalities as a consequence. This was all made worse by the COVID pandemic. So if we throw in the two peak COVID years, you see that very clearly. But importantly, the changes predate COVID by a long period of time, or a good number of years. And we see variations of this in every single part of the UK that you want to look at. So pick a city, any city. This is Liverpool in the northwest of England. In that city, I've got to stop doing this. In that city, death rates in the 20% most deprived neighbourhoods were coming down, as they should do. Then they stopped and they started to go up. Pick another city, any city. This is Leeds in the north of England, with dramatic increasing death rates in the 20% most deprived areas, a spectacular widening of inequalities. And bringing it back to Glasgow, where we are tonight, if you look at female premature mortality, there's the most extraordinary reversal of previously sharply falling mortality rates, again among people living in the poorest areas. And as we're in Glasgow, it's just worth zooming in for a second to make the obvious point that on this chart, if you go back a decade or so, then what you had, relatively speaking, was a bit of a success story, because death rates were coming down overall, but coming down much more sharply in the poorest areas. So this is a picture of narrowing inequality, what everybody wants to see, what governments claim they want to achieve. But fast forward to the next decade, and death rates in the poorest areas had become higher than they had been 20 years ago. This is as unprecedented as it is horrific. And to come back to both the subtitle of the book and the title of this whole talk, these changes coincided with the implementation of the UK government's austerity programme, which has cut public spending by truly, truly, truly astonishing amounts. We go into a lot of detail of this in the book, and I'm not going to do it tonight, but astonishing amounts, and are therefore impacting on vital public social services that so many people in the population rely on, depend on, and need. And within that, has seen cuts to social security on a truly, truly, truly extraordinary scale. And social security, as you all know, is a safety net for people living in difficult circumstances. If you just take that safety net away, what happens? Well, the data show that people die, and they die younger, and they die in increasing numbers. And this is all quite emotive language. And in public health, you have to be very careful that what you are saying is supported by the evidence, that it's evidence-based. But the answer to this question is a big, big, big yes, because there's so much evidence, and the evidence is actually on different layers. So there's a huge literature, evidence base, what you want to call it, on the very topic I'm talking about tonight, the fact that political decisions impact on the health of populations. More relevant than that is the considerable amount of international evidence of the detrimental impact these kinds of policies have on the health of populations. And this now comes from a whole number of studies across a whole number of different countries. And this last paper, again led by the co-author of my book, I've not got much hair to toss back anymore, showed that across all high-income countries, wherever some form of austerity policies were implemented, it had a negative impact on mortality rates. In other words, it harmed people on a big scale. But much more relevant even than that is the absolute wealth of evidence from within the UK of the impact of the particular form of austerity that has been implemented here, with its focus on the needs and the income of the poorest and the most vulnerable in our society. And we see this impact along really well understood causal pathways, how it makes people sick, how it leads to early death, in terms of, first of all, increasing levels of poverty, And I'll show you some poverty stats in a minute. We've spoken already about how poverty impacts on health. But we also see it from studies that have shown the impact of austerity on increased numbers of food banks, for example, on increased levels of homelessness, for example. How, as I said earlier, this impacts on people's poor mental health, including especially the mental health of particularly affected populations. As I said earlier, there's a clear link between poor mental health and poor physical health, and so we've seen its effects trickle through to changes in death rates for just about any age group you want to look at. This was a study looking at old age mortality, but we've seen changes for all age groups. And we've also seen it for all major causes of death. This was a study looking at the impact of austerity on drug-related death, which I'll come back to just shortly. But we've seen changes in all the major causes of death, and therefore the effects have filtered through to impact on overall mortality rates and life expectancy in Scotland, in England, and indeed across the UK. So come back to this question, is there evidence to support this? There's bloody masses of evidence to support this. And this is evidence that has come from people working in different countries and within the UK in different institutes using different data sets and different methods, but all coming to the same results, that these policies have fundamentally harmed the health of the population. And I would go further and say it's actually changed the very nature of the society we live in. And I mean that with regard to a number of different aspects. So I've mentioned briefly food banks. It's worth just pausing for a second to remember that food banks are now kind of normalized here. You go into a supermarket, there are collection points for food banks. You turn on the TV, they're talking about food banks. Prior to 2010, when these policies came in, food banks did not exist in this country because they were not required. There's a really nice paper from colleagues here and at Heriot-Watt that have quantified this and spoken about how any food banks prior to 2010 were kind of on the fringes. If you don't want to read another dull academic paper, just look at some of the data. This is from the Trussell Trust on food parcel provision. This extraordinary change in a very small number of years. This is obviously linked to poverty rates, and child poverty rates were coming down prior to austerity and have gone up across the UK ever since. And child poverty is a really important indicator because the evidence shows that certain groups in society have been particularly affected by these policies, and younger families with children are one of those groups. And actually the changes in child poverty rates in the last 10 years in the UK have been shown by UNICEF to be by far the worst of any high-income country on the planet. So this is properly shameful stuff. We've seen it in relation already. I've already spoken about mortality trends, and I've mentioned drug-related deaths, but it's worth just making the point that there's very clear evidence that austerity has exacerbated the existing drugs death crisis that we have in this country and also impacted elsewhere in the UK, with evidence around the impact of cuts to services and the cuts to the income of a very vulnerable group, resulting in dramatic increases or further increases in deaths within a couple of years of austerity coming in. We see it in relation to other measures of population health, as some of you will know and can guess from the name. This is a measure which captures not just how long people are living, but how long they're living in good health. In a rich society like Scotland, this should go up. It's been going down. And in the poorest parts of Scotland, people only living in good health into their 40s. Their 40s. When does a statistic become something that, some kind of scandal that requires some kind of response? We see it in relation to mental health trends, which have been going in the wrong direction for sections of society. And in one of the chapters of the book, we lay out a lot of evidence showing from different studies the impact of these cuts to services and cuts to social security on the mental health of affected populations. And we've even seen changes to quite different indicators, like the number of babies being born prematurely and or of a low birth weight in poorer areas, again coming down before austerity, having gone up ever since. And this is again about the words I mentioned at the beginning about stress and poverty, because the evidence shows it's about the impact of maternal stress on babies growing in the womb, driven by increased financial stress, so again poverty. And you may or not have seen some coverage of this earlier in the year. And I can throw lots and lots and lots of more stats at you, but I think it's quite important sometimes just to get behind the stats. And in the book, we prefaced every chapter with a different quotation. And this is a quotation that was attributed to an epidemiologist called Austin Bradford Hill, who said that health statistics of the type I've been throwing at you, data, the numbers, the charts and all that, they represent people, but with the tears wiped off. I just think it's a totally brilliant way of getting at the fact that behind all these numbers and charts and data lie the stories of real individuals affected by all this. So in the book, what we did was we interspersed all the evidence with 7 real-life stories of people who've been affected by these policies. 4 of them are on your screen at the moment. I'm not going to go into their individual stories, other than saying that each one is illustrative of a different aspect of austerity. So from people who are clearly basically too unwell to work, but were forced by the system to work with disastrous consequences, people impacted by cuts to social care, by cuts to housing services, by the bedroom tax in England, examples of so-called welfare reforms on people's mental health and on people who use drugs, and the truly pernicious social security sanctions, such a horrible word anyway, but the punishments dished out by the system on those that the system thinks are not doing what they should do. And we also dip into a little bit of the qualitative work. So Jerry and I tend to work more on the quantitative side, using these data sets to quantify the impact of things. But qualitative research is so important in terms of understanding the how, how these things impact on people, how austerity and associated poverty impact on people's lives. How, to quote some participants just from one study, it makes you feel as if your world is collapsing around you, damaging you physically and mentally to the point where you can't go on. How people have to rely on their children for something to eat rather than the other way around, and how that makes you feel. How you're taken to the stage of saying, well, what's the point? I can't go out, I can't see people, I can't even eat properly. And just one aspect of austerity, the introduction of universal credit, was described by one participant as insidious brutality. So where does this insidious brutality and all the rest add up to? Does it add up to the title of the book? So as I'm sure many of you are very well aware, this is not an expression we came up with. This is an expression most famously used by Friedrich Engels, who was a German philosopher, writer, social scientist, and many, many more things, including, as you can see, an early champion of the hipster beard. And Engels used this expression most famously in this book, which he wrote when he was working in Manchester at the time of the Industrial Revolution. And he used this expression, social murder, in relation to the appalling working conditions and the appalling living conditions that were prevalent in the city at the time, and which directly led to appalling dying conditions. Because Manchester, like other industrial centres like Glasgow at the time, was characterised by very, very high mortality rates, including very, very high child mortality rates. And his anger in using this expression was targeted at the factory owners and the private landlords who were profiting from this misery, but also more generally at those in power that allowed these conditions to exist and to persist. And in that latter sense of talking about people with power and responsibility who make decisions that harm others, this term social murder has been used in lots of different contexts since the time of Engels. So in relation to the Grenfell fire tragedy, for example, in relation to the COVID pandemic and government's responses to it and non-responses to it, but also in relation to health inequalities, because health inequalities are entirely political, and that includes the choice of austerity, which has harmed so many people. So in the book that we wrote, we just kind of laid out all the evidence and we left it up to the reader to decide what's the most apt description. But whatever the description is, it's a politically created tragedy which needs a political remedy. So let's just finish by talking about what the remedy has to be. So the most important thing when you're talking about policy responses around health inequalities generally, which Graham was alluding to earlier on, the most important thing to understand, it is no mystery what has to be done, because the solutions to health inequalities, no matter what some people will say, are hugely well understood. There has been international reviews of evidence of what policies work and what policies don't work to narrow health inequalities. So the evidence is all out there, it's all published. And basically, in relation to the last 15 years, you have to reverse what's been done. You have to create a social security safety net that people can turn to when they need help. You have to invest in the services people need to live healthy lives. And more broadly, to narrow health inequalities, you follow the evidence around what works to narrow societal inequalities, to reduce that social gradient that we talked about at the very beginning of the talk. But the problem is this requires political will. And the other problem is it doesn't exist at UK government level. I'm going to show you a rather disturbing photograph now, and I apologise in advance. I'm not trying to shock or offend, but I think it's important when you're talking about austerity that you're quite honest about what it looks like. So there you go. So it's worth just recalling that austerity was introduced in 2010 by the Conservative Liberal Democrat coalition. And in that very first Parliament alone, they introduced more than 150 separate changes to social security, impacting on eligibility and levels of social security, which impacted on the lives of literally millions of people. That was then followed by hundreds more changes by the Conservative-only governments, including those that were led by, as you'll remember, some truly, truly, truly inspiring figures. We've now got a different government in power at Westminster. They've been there about a year and a half. And as you know, this has been a cause of absolute rejoicing in the streets, general celebration, strangers hugging on pavements and all the rest. All that said, 2 weeks ago, and here it is finally, the good news slide. Took a while to get there. 2 weeks ago, they announced the end of the two-child benefit cap. And this is really, really, really good news because modelled estimates show that this will take a lot of children out of poverty. However, it's worth just noting that that is one, I'll say it again, one change of literally hundreds that have been made over the last 15 years. And on top of that, they've obviously previously introduced their own austerity measures in terms of further cuts to people on disabilities. Because obviously, if you live in a really, really wealthy country and you want to save some money, it's important to look first at poor people who are vulnerable and who are sick. Just to finish, what should we do then? I think this is a really, really important question. It's a question I've kind of struggled with for the last few years. So the book was published a year ago. It was written a year before that, but we've been doing research in this area for quite a long time. And I'm always thinking about what should we do. And it was only about a year and a half ago that I finally got the answer. And I think it's this. And then I think it's that. But on top of that, I think there is a need to shout about this because I don't think enough people are aware of what's been going on, and policymakers, politicians need to understand the evidence of the harm all this causes. So if you take one thing from tonight, it's just maybe if you care about this, just maybe try and use your voice to highlight the injustices, because there is a lot of evidence around, things like social movements, how policymakers respond to public opinion. And if people care about this and shout about it, then maybe we can make a bit of a difference. That feeling you've got in your stomach, which you're thinking is hunger or maybe just a desperate need for a drink, could possibly be that festive warm glow that I promised earlier, or maybe not. Thanks very much for listening.
That's low. There's gaps there. Yeah. Is someone at the back? At the back. Please. So those who have to leave have left. I think that there was one word for that, and that was shocking. I think if you weren't shocked, then you must be very well informed. There's one question. Does Brexit contribute to this?
Well, it's part of the mess, isn't it? But in terms of the evidence around what's driven the changes to health inequalities, it's been more about austerity. But Brexit is not helping obviously.
So the floor is open for questions and comments. Can I, with the red jacket?
Hello. Thanks very much. Very interesting. You mentioned the change at 2010. Could there still be a phasing element here? And I'm thinking of Harry Burns's work, suggesting that stressed parents leads to very stressed children with brain changes that lead to consequences, decades later. So like infectious diseases, is there an incubation period here?
So I was just thinking of a way of trying to lift the mood, but it's kind of sunk a little bit there. So unfortunately, you're correct. So there's two things to say. First of all, there's a massive amount of evidence around the long-term impacts of being brought up in adverse conditions. So with child poverty increasing so much, and child poverty levels in particular parts of the UK are now extraordinarily high, then the evidence around the higher risk of lots of negative things in adulthood and later childhood is real. And also the stuff I pointed to in terms of the increased numbers of premature births and low birth weight births, that also is associated with a lot of evidence of greater risk of all sorts of issues. So in that sense, I'd say austerity has never gone away because, as I said, only one of these policies has been reversed out of hundreds. And secondly, it's going to be with us for a long time in terms of the long-term effects of this.
My question is, if this trend continues, will it eventually lead to some kind of societal collapse?
If the next question I could have a joke, that would be great. Well, I don't know how to answer that really sensibly, other than what's really dangerous to do is to make projections. So the National Records of Scotland have produced some projections today. Well, the latest estimates on life expectancy with some projections. And the projections are always going to be a bit flawed because 10 years ago they brought out projections and they were nowhere near reality because different policies were implemented that affected these things. So I think it's very, very hard to predict what's going on. That said, for reasons I've already alluded to, things don't look rosy going forward, which makes it all the more important that people shout about this to try and get different kind of policies introduced.
At the very back.
I'm trying to dig for some good news somewhere. One of the few benefits that has gone up because of the triple lock is the state pension. Does that lead to any visible positive outcomes in the analysis that you've done?
So it is, relatively speaking, a good news story. I mean, just about anything, relatively speaking, to what I've just presented is a good news story. So in terms of pensioner poverty, it's fluctuated a bit recently, but generally speaking, that used to be very, very high and it's come down quite a lot. The triple lock plays a part in that. So if you're looking at poverty across the population, as I've shown, child poverty rates are going in horrible directions, although there's a little bit of work in Scotland that is helping to mitigate some of that. But pensioner poverty is one of the better news stories of the last kind of 20 years. So there has been improvements there.
Although pensions in the UK are the lowest in Western Europe.
So I'm trying my hardest, Graham. So just looking at UK trends, though, relative to other groups, the pensioners have, I mean, they were poverty levels were not in a good place, but they have improved.
Please, yes.
One of the things you were talking about in your charts and things like that is how things were generally improving, but the beginning of the sort of turnaround moving in the opposite direction was possibly as far back as the 1970s, which is maybe an arbitrary date, but it's about the time when in Scotland in particular, manufacturing began to decline. And so many traditional manufacturing, so many young people, for instance, who had left school, even if they weren't necessarily going to ending high academic things, they could go and get jobs in local with local employers. And even older people, if initially if they lost their job or they had to change jobs, they could usually find reasonable work elsewhere. Whereas that became very rarer and rarer, in particular in areas like traditional things like manufacturing, and people, the industries that grew were things like high tech and finance.
Yeah, you're absolutely right. So there are different things going on here at different time periods, and that was kind of partly the thinking of doing it in the two halves. And what you're talking about is the process of deindustrialization effect and how that's impacted on society. And again, the kind of consequences of some of that are still with us today. So I talked briefly about drug-related deaths, more in relation to the big increases in the last few years. But there's very solid evidence that the existing drug death crisis, a good chunk of it relates to people who are particularly affected by those processes of deindustrialization, increased poverty and increased inequality in the 1980s. There's particular groups of people who were born in the 60s and 70s, particularly in more deprived areas of Scotland, that were particularly affected by that. So there's decent evidence of this kind of birth cohort moving through time, and they're now aging and experiencing lots of conditions as they do that, and that's a big contributor to the drug death factor. So again, it's about the consequences of policies that are still being felt many decades later.
On the plus side, the previous Labour government did reduce child poverty from 30% to 20%.
Yeah, and it's a really good example of how this can be reversed, and it's a really good example of how particular policies can really have beneficial impacts. He says,
would you say the same about the Scottish child payment?
So again, this isn't rocket science. You know, all of this stuff has been caused by cuts to support for people who need support. So if you introduce new benefits that support those people, it has an impact. And so we've already seen that in relation to child poverty levels in Scotland having not increased in the most recent period, but having gone up everywhere else in the UK. And that's because of the additional support here. As I was saying to Graham before we started, there was a book by, I've now remembered her name, Mary Shaw, about 20, 30 years ago, called The Widening Gap. And in this book, they showed the kind of top 10 worst areas for child poverty in the UK. And at this time, and we're talking 90s, I think, can't remember, 80s, 90s, I can't remember, of the top 10 worst places, 8, I think, were in Scotland and 7 were in Glasgow. If you look at the same data now for the worst levels of child poverty, I don't think there's any in Scotland. They're in the kind of northwest of England, kind of Blackpool, these kind of places. Because although child poverty is still hugely problematic here, relatively speaking, it's got a lot worse in England. And the evidence already is that the Scottish child payment is starting to play a bit of a role in terms of having some kind of beneficial effect.
Yeah, well, that would be a good story for BBC Scotland to cover.
Thanks very much for that really chilling talk. Now, Graham has just pinched what was the topic of my question. Back in the summer, we went to hear Danny Dorling speak in Edinburgh, and he uses the Scottish child payment and other benefits in Scotland, such as free prescriptions, when he's talking in England, and people in England can't think what country he's talking about. But I mean, are we as the Scottish government really just pissing in the wind by, you know, just trying to put a bit of sticking plaster on all this?
I've used that expression, pissing in the wind, in similar conversations. So this is not to downplay anything the Scottish government has done in those areas, because they've done really useful things. Some of the evidence around what do you do about health inequalities talks about you have to have policies at different levels, okay? So you have to have high level policies about basically making society more equal, so redistributing income. Then there's kind of middle level policies where you do things like trying to tackle alcohol harm or housing and these kind of things. And then there's a kind of lower level where you try and help people most affected by these things. At the middle level, the Scottish government has actually done quite a lot of useful things over the last few years, but its powers only really extends to that middle level. So while they were building more social housing, for example, until recently, while they were doing minimum unit pricing for alcohol, trying to tackle that, while they were trying to do what they could to a degree, I think they could always have done a lot more, it was at the same time that these austerity policies were coming in. So it's like a kind of balance. So for every kind of good thing, it was just being undone. So I think they could do more. I think they could still do a lot more, but they have done useful things, but it's been overshadowed by what's happened at Westminster through those years. So I think what you have to do, obviously, is to try somehow, and there's a big issue here about how you get these messages out. We've been trying very hard with this and not very successfully, I don't think, but how you get these messages out to try and change policy at that level as well, at the Westminster level as well. we went down to the House of Commons with the book recently. There are 650 MPs in the House of Commons, so we sent them all, I think, 3 emails, so that was 2,000 emails we sent. And then I sent 120 personal emails showing data for their constituency areas, showing increasing death rates among their constituents. So how many MPs do you think turned up for our meeting? 6, exactly right, 6. So there's a real issue around how you get engagement and how you, so trying to directly engage with policymakers, I think is very hard. And I think what you have to do, as I said at the end of the talk, is try and somehow get the messages out whereby people demand change, people, you know, public opinion drives policy making rather than just, you know, us trying to kind of get in the, you know, words in the ear of a particular person.
A question about policy. Sorry, now this is on. Thank you very much for the talk. Just an observation is also since 2010, recently in the FT, John Burns-Murdoch did a really good data points analysis that top decile of earners are paying a higher and higher proportion of the total income tax take, and it's much higher than most European countries. So that's just the observation that our policymakers are trying to deal with. But as a piece of your work, have you ever been able to look at any differences between the new towns, East Kilbride, Glenrothes, Cumbernauld, and Glasgow, and whether that's had any impact on the sort of outcomes that you're talking about now?
Yeah, so this is the middle bit that I skirted over within about 10 seconds because I didn't want to give you another 50 minutes of PowerPoint. So in terms of the story of why health inequalities are wider here than down south, and there's a lot of work we did 10 years ago now around why Glasgow is a lot worse than places like Liverpool and Manchester. So that 350-page report I mentioned got into all that. It's a very, very long, complex story, and there's lots of different historical factors. But one of the things that happened, on top of many other things, was at the time the new towns were built to deal with the population overspill in Glasgow, and they were built outside Liverpool and Manchester as well, there were particular policies implemented. So you were only allowed to move to the new towns if you had a job, effectively, a skill, a trade. If they targeted kind of younger families with children. And so there was a kind of selective migration, if you like, from Glasgow to the new towns at that time. And in that report, and then if you're interested, I can send you this link to a presentation. We quote various reports from government reports at the time, talking about how basically they are skimming the cream of the population and leaving behind a population at that time that was basically, I think they said, the old, the poor, the unemployed. So it's not that that's what caused wider inequalities in Glasgow, but it was that on top of about 10 other things that we listed that were all kind of adverse policy making. Meaning that when you compared Glasgow with Liverpool and Manchester, although they were quite similar in terms of their histories of deindustrialisation and levels of poverty, just people had been living in worse conditions in Glasgow, and there'd been all these kind of policy changes that had detrimentally impacted on the composition of the city, if you like. So it's part of a longer, complex story.
Thanks.
Thanks very much, David, for that not very cheerful talk. One of the things I wanted to ask you about, several years ago, there was a book published called The Spirit Level, which suggested that it's not just absolute deprivation that matters, but it's also people's perception of their position relative to others in the same society. So I wondered if you see any of that in your data, that the rich are getting richer and the poor can see that, and that has an adverse effect on the health of those that are deprived on top of the absolute deprivation.
Yeah, so I have a golden rule which I've broken tonight. So my golden rule is never to speak for more than 30 minutes, but I was encouraged by whoever it was organising it to speak a bit longer. So the stuff I included at the start about the kind of social gradient, I gave a kind of simplified version of that, which is, you've got poverty, and every step away from that is a step away from poor health in that sense. But the other side of it is the Wilkinson stuff around the spirit level, which is basically saying that in more unequal societies, it's worse for everybody. So the greater the inequalities, the more of a kind of breakdown in societal cohesion, if you like. So it's still bad for you at the bottom, but if you're in the middle and the gap is very wide, then you hate the people above you because they're so far away from you, and you're fearful of the people below you, and it becomes this as I say, kind of lack of breakdown of cohesion, breakdown of trust, and it's kind of bad for everybody. And if anybody's not read the spirit level, I'd encourage you to do it. It's a really, really easy read, and I think the evidence is quite convincing that basically inequalities is very bad for you, and the wider they get, the worse it is for society. So there's that sense of you increase poverty, you get inequalities that way, but it has other knock-on effects about basically being a miserable place to live, and they show associations between wider inequalities and all sorts of adverse outcomes, from kind of education factors to, I can't remember now, life expectancy, to lots of things. So basically inequalities is bad in many, many ways, and I was going to include all that, but I was just thinking, how many slides can I include in one shift?
Thank you for revealing the current reality in such detail. Is it not the simple truth that for as long as Scotland has to rely on the Westminster block grant, nothing is really going to improve?
I'm not sure if you're trying to get at something there, question. So I was working in a different organisation back in 2014, and we got asked similar questions. And the answer is, so the question is, to translate it, is would Scotland be better in regard to all this if we were independent? And the answer is, well, it depends on what policies they introduced. So it's a bit like the projections of life expectancy. Who knows, what would happen? But certainly, in terms of what's happened in the last 15 years, Graham alluded to the fact we look at a lot of data. We've looked at a lot of data for years and years and years. I have never seen anything like the changes to inequalities that we've seen in the last 15 years. So you would maybe like to think it wouldn't have been that way, but then we're in the world of guessing at that point, aren't we? So.
Leave it on, David, getting media coverage of this stuff.
Well, that's an interesting question. So, if this was a presentation just about the book, I would have done a whole section on the lack of awareness of all this, and the media part is really important to this. I've been pretty staggered by the lack of awareness around all this in relation to not just the public, because that's just something, but in relation to politicians. So we've been through the Scottish Parliament a number of times. I was staggered by people's lack of awareness. Politicians who had briefs for kind of health-related factors had no idea about all this, and you're thinking, why do you not know about this? And then it gets into a question, well, why doesn't everybody know about this? And there's all sorts of discussion about, is there just so much bad news in the world that people can't take it anymore? Is it our fault as researchers for not disseminating the evidence properly? Is it the media's fault that you're alluding to? In our defence, we've tried very, very, very hard to get this stuff out there. So we produced not just the book, but before the book, we had various journal papers, we had various reports. We at one point took advice from a kind of media specialist to try and get this in the media. So we brought out, I've not got into this today, we did some analysis basically comparing what had happened to death rates in the last 15 years or 14 years at the time with what should have happened. So if previous trends had just gone on the same way. So that the difference, it's a very crude number, but the difference of the excess deaths across Britain was about 330,000 extra deaths. So that's more than died from COVID, okay? And I'm not downplaying COVID in any way, shape or form. So that was published in a peer-reviewed journal, and we sought coverage of that. We had a general media release. I spent the entire day trying to speak to journalists about it. In the end, it was in The Guardian, to be fair, although The Guardian readership wasn't really who we were trying to reach. We were trying to reach the other readership. And nobody else is really interested in the media. I did an interview for BBC Scotland, and I'm not good at bigging myself up, but when you do these media interviews, you have to just try and get, the main points across. And for once, I thought I did it really well. I got the main points across. I was quite coherent. And they played the interview. Apparently, it was at 6:30 in the morning. And by 7 o'clock in the morning, I'd been replaced by a story about a college course for keeping chickens. So on one level, quite funny. On the other level, more people have died from this from COVID. Why is that not of interest? So you can get into all sorts of conspiracy theories, whatever, but it was really, really weird given the effort we made to get coverage of this and the lack of interest in it. Some of the most recent stuff that I showed there, Liverpool, Leeds and all that. So we deliberately did the analysis to include English cities because we thought that will get interest because a lot of media down south don't really bother too much about Scotland. That will get interest. And in the old days, when you produced a media release like this, you would clear your diary for a day because you're going to have to speak to journalists for the whole day. There was absolutely no interest. This was analysis showing what was happening in Leeds and Liverpool and Manchester and Birmingham, increasing death rates. There's a media release from the university. It's published in a peer-reviewed journal article. This is kind of like faultless in that sense, and nobody was interested.
Something that does get a lot of coverage is Scottish drugs deaths. How do you see that as part of this overall picture?
So I've alluded to it to a degree. So the changes that we've seen in Scotland and England and the rest of the UK, Northern Ireland and Wales are at the whole population level exactly the same. So I've shown that. When you look at early deaths, if you kind of look by different age groups, the changes to premature mortality, like the one I showed for Glasgow for females, are worse in Scotland. And a proportion of that, not all of it, a proportion of it relates to Scotland's worst drug-related deaths crisis. But as I tried to point out, this is all quite circular because the evidence shows very clear that austerity policies have significantly worsened the drugs death figures. As I said, because of the evidence around cuts both to services to help people and also cuts to the income of a very, very vulnerable group. So we spoke to people working in addiction services in Glasgow, and they were just saying, well, if you have a very vulnerable group, like people who are using drugs, and you either reduce their money through cuts to social security, or you take it away completely through these sanctions, then what people look for, and these are his words, was they look for oblivion, they look for a way out. And if you look at those figures, within a couple of years of austerity coming in, there's just the most shocking increase in drug deaths. So this is quite circular. The higher drug-related deaths here play a part in the overall premature mortality figures, but they themselves are influenced by the austerity policies that we're talking about.
Most of the data that you showed revolve around overall death rates, but what's the picture right across the age spectrum, particularly children, and also to do with chronic diseases?
So the evidence is that all age groups were affected. So there was a paper colleagues did that basically broke all this down. So all age groups were affected, and we saw changes in all causes of death. And that's really important because it points to a single common cause driving all these changes rather than individual particular things. There are variations, so drug deaths have been affected considerably. Deaths from CVD, cardiovascular disease, have been affected a bit more than other ones, but there's been changes everywhere. So any cause of death you want to look at, there's been changes, and all the age groups have been affected as well.
Do you think that living in a more digital age where people are able to spend a lot of their life isolated in terms of a select few people has increased the sort of separation or isolation between classes and between people of different economic backgrounds, and that contributes to the lack of awareness or knowledge of these issues, and basically like increased physical separation between people of higher and lower incomes?
I think it's really important when you're asked a really good question that you don't know the answer to, that you don't try and bullshit. I honestly don't know. I think I mentioned briefly mental health trends going in the wrong directions for sections of society. It's kind of a lot of kind of younger people as well. The stuff I've talked about plays a part in that. I think lots of other things are going on in society at the moment as well, including the stuff you're talking about. I'm not really aware of the evidence in terms of, or I couldn't really speak to the evidence around how that might be impacting more on the things you're asking around. I suspect it's a very, very sensible question, but I genuinely don't know the answer.
Online, the better off are living into their 90s. Does this not skew your figures?
I'm not sure I understand the question. So one of the so you mean if we excluded the older ages, would you see more of an effect? Is that the question? So there's two things to say. So one is we've looked across different age groups, and so if you do exclude deaths at older ages, you see even more impactful changes. So the one I showed for Glasgow was premature mortality rates, and we've shown premature mortality rates in lots of cities, quite dramatic changes. The other thing, which I'm not sure if this is getting at or not, but when some of these things were becoming apparent, one of the responses from politicians actually was to say, well, people can't live forever. You know, this is just a kind of natural end to, you know, life expectancy can't go on forever and ever and ever. But the point is that in other countries, for example, Japan, like life expectancy is already higher and it's still going up. And also the biggest changes have been in the poorest areas where life expectancy is already way, way lower than any kind of natural ceiling to it. So it's not about that at all. I'm not sure if that's the question. I think it's probably the first answer is more appropriate.
Thank you. Another question. How do we afford to deal with this tragic situation as we're a country with so much debt after COVID, etc.? How do we balance the need to foster economic growth versus also paying for better social services?
Yeah, so I'm not an economist, and I take a pretty simplistic approach to this. And we quote figures in the book about the wealth of countries. And despite I don't know why I'm looking at you because they're online, but despite the narrative about, you know, Britain being broke and all the rest of it, Britain is a hugely, hugely, hugely wealthy society. It's just that wealth is massively unequally distributed. So the simple solution is you use the wealth to support people who need the support. And anything else that you read around all that is just a kind of false narrative to kind of excuse the policies that are in place at the moment.
The UK is the sixth wealthiest country.
I was just saying the UK is the sixth wealthiest country in the world.
Ask about the nature of employment changes over these periods of time. So, for example, the shift from manufacturing to services, rise of gig economy in recent times. And the reason I'm asking this is we're about to shift into another big change in employment with the rise of technologies like AI. And I'm wondering how that will play into this. So beyond some of the sort of policies you've mentioned, what needs to be done in this space?
So it's a really good point. What we've said in sort of describing some of this stuff is that, you know, those changes to the nature of employment, so the gig economy, etc., aren't the big drivers of what we've seen, but they've not helped either. So kind of levels of in-work poverty play a part in this in terms of people are working, but they're not earning enough. And that gets into the whole kind of gig economy stuff. So there's lots of other things, a wee bit like Brexit as well. There's lots of other things that are going on around this as a kind of perfect storm, if you like. I don't have the answer to what you do going forward. I think the current UK Labour government are bringing in some legislation around employment to try and improve this. I think I'm not really very sure where it is at the moment, but you're absolutely correct to identify it as another contributory factor.
Thanks for the talk, David. I'm trying to think about what I'm going to see at the warmth of my Christmas cocktail party. You've told us of the 150 policy issues and austerity that have harmed people. And you've also highlighted the importance of repealing the two-child benefit cap. Rather than saying to the people I'm sipping cocktails with, there's 150 things we've got to do, can you give me 2 or 3 to prioritize that might make a noticeable difference in the next 3 to 4 years And I'm thinking of in the sense of an administration and its election cycle to make a meaningful difference that people can notice to buy into this change in approach.
So only in the West End of Glasgow would you get a question about austerity framed around a cocktail party. So it's a really good question. I would actually say, so I mentioned 150, it's a lot more than 150. That was just in the first Parliament alone. There's hundreds more after that as well. So your question is, what do you do about it? What kind of few things could you do about it? So the book that we wrote, and before we're accused of cashing in, all the money was going to charity, by the way, so there's at least £12.50 has gone to charity from them. It finishes with a chapter on what do we do about this, basically because we recognised it was a thoroughly depressing book. And it kind of comes back to what I was talking about before, at the end of the talk, in that we know what we have to do about it because the policies that would reverse what's happened in the last 15 years are actually very, 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 very clear. So yeah, the two-child benefit cap is an important one to reverse. It was described by one academic as being emblematic of austerity, given all the coverage it had. But again, it was only one out of so many. But in terms of what you do about it, it's there. It's there. We know what has caused the problem, so you reverse that. And more broadly, in terms of making society a nicer, more equal place, as was asked by another questioner, the evidence around how you do that is all there as well. You have no idea how much stuff there is out there published on websites. It's all there. But it comes down to that thing is you need political buy-in, you need political will to implement it. Coming back to, I think you mentioned elections, and again, so the Scottish elections are next year, and again, there is more they can do. So that there's been work done by, for example, Joseph Rowntree Foundation about the amount that Scottish child payment needs to be increased by in order to make the Scottish Government's own child poverty targets. But at least they still have child poverty targets, because another one of the things that the UK government did was just to get rid of child poverty targets, because that solves the problem of having to worry about child poverty.
It's interesting that the population groups most affected by what you describe are being targeted by reform.
Well, I don't know how depressed you want to make an audience.
That wasn't the question, it was a comment. So.
A very depressing talk,
You're welcome.
but interesting. I wanted to ask a question about, because it feels overwhelming, the scale of the problem. And I think obviously part of that is the lack of will to make fiscal changes in the UK. But also I think it can just feel like something that's irreversible. And I wanted to ask you, and you might not, this might be irrelevant, but I wanted to ask you about the actions that President Carter took in the US when he did his enrichment program. And that was the first thing that Reagan got rid of when he went into power. And yet the Americans, I believe, are still seeing real enhancements in people's lives through just a real short policy over 4 years. They're still seeing long-lasting effects 50 years later. So it seems like there could be something that we could really do if we were prepared to spend enough money.
So I can't claim to be an expert on what President Carter did, but to turn this around in a more positive sense, I have presented in the second half an example of how policies widen health inequalities, but you can also show the opposite. So history shows you at various times, actually in America, but before the time of Carter in the 60s, there were particular policies implemented then that were beneficial. If you look at actually the UK in the post-war period, you look at Scandinavia in the post-war period, you look at Brazil post-dictatorship, you look at East Germany after the fall of the wall, they are all examples of where health inequalities were narrowed. And what they did is basically the opposite of what the UK government did with austerity. So basically it was all about social security expansion to help people, poverty reduction, income maximisation. So again, it comes back to my earlier point that the lessons are all there. You know, this stuff is all out there. It's not that we don't know what to do. We do know what to do. And we also know, and it's a really important point you raise, that policies can have a lasting positive impact. But it's about making the people who can implement these policies, make them want to do it.
I mean, Lyndon Johnson launched a war on poverty, and one of the flagship programs was Head Start, which famously claimed that a dollar spent preschool earned $7 for the economy later on, and that was mirrored by Sure Start, especially in England, which was a beneficial and effective policy which has been withdrawn. So there are some things actually on the shelf that could be taken off the shelf.
Yeah. There's another book just come out, which is it's the kind of opposite of our book. It's called Getting Better, and it's trying to be a more positive book by Kat Smith and Claire Bamber, another colleague, and they use America as an example of that, and it's actually a really good example again of different policies, because at the time that those policies that you're referring to, Johnson's policies, you see very clearly a narrowing of inequalities, and then you get to the 80s when Reagan came in and you see a massive widening inequalities, and it's quite a nice is the wrong word, it's an effective example of seeing how policies directly impact on health inequalities in a society.
Yeah. Any questions at the back, Tony? Yes, there is one there. Right. And then here.
The government's, like the Scottish Government and COSLA's population health framework that every Scottish Government directorate are being asked to answer upon kind of just now with any work that's being done in government, do you think that goes kind of far enough, or like to try and deal with some of these inequalities?
I missed a little bit. Did you say, so the new framework, do you think that goes far enough?
Yeah.
Is this going out live? I think it could do more. There's a lot of consultation went into it, and I think it could. Yeah, I think more. I don't know who's this going to. I think it could be better and more and do more. I'm going to stop talking.
So a couple more.
Hi David, cheers. Thanks very much for the talk. It was, I wouldn't say fun, but definitely interesting. You kind of alluded through it throughout the whole kind of talk, the time we've been talking about this education. I'm a firm believer that education is arguably one of these most important factors when it comes to these things, obviously alongside the policy. And it was about, we've seen this rapid increase in childhood mortality and poverty more specifically, but almost counterintuitively, we see this massive spike, nearly doubling our childhood rates of obesity as well. So I was more to get your comment on that, whether, you know, it's not a lack of food, or if it's more the type of food that's available, if, you know, normal quote unquote healthy food is, you know, more expensive than, you know, this kind of easier to attain, higher calorie, more dense kind of food. Just
so basically the causes of childhood obesity is what you're getting at. So there's an expression called it's called the obesogenic environment. So it's the environment that kind of like promotes obesity in the population, if you like. There was a famous report called the Foresight Report about 10, 15, 20 years, 20 years ago. And they produced a diagram, and it's the most mind-boggling diagram you've ever seen in your life. It's extraordinary. But it's deliberately that way, because what they're doing is they're showing the connections between all the different things that drive that. So from, you know, the food industry, to whether there's any kind of policies around physical activity, to advertising of rotten foods, to the lobbying of governments, to all this kind of stuff. So it's a really, really complicated thing. I think, again, the evidence is all there, and the kind of policies that would be effective, I think, aren't that hard to find. But it is a complex interaction, and it comes, again, around this word about politics. So there's so much kind of lobbying of governments by the food industry, and also obviously alcohol industry, tobacco industry, also the gambling industry. And basically you have, in effect, weak and or corrupt governments that give into that. And so all the stuff, you know, you walk into a supermarket and it's just rows and rows of unhealthy food. That could be done, that could be got away with. But it doesn't, because the food industry is whispering in government's ear saying, don't do that, don't do away with. So there's really good examples of advertising. So where advertising against unhealthy foods was to be implemented and it was scrapped or postponed or delayed or whatever. And all around successful lobbying by the food industry. I mean, there's a whole, you know, the whole history of the tobacco industry doing this, but the food industry and other industries do it as well. So it gets called in our world as the commercial determinants of health, but it's hugely, hugely influential. And it needs politicians to stand up and kind of stop it. One of the, I'm now rambling, but one of the vaguely interesting examples in recent times is minimum unit pricing in Scotland. So according to an advisor who was speaking at an event years and years ago, part of the reason that got introduced was that when the SNP came to power as a majority, nobody had really expected that. And so the lobbyists weren't ready for it. And before they knew it, they brought in this policy. The policy is shown to be effective. You'll have noticed it doesn't exist in England. And that's because the lobbyists are being successful again.
One last question. Tricia?
Thank you again. We know that language is important, and the language we use about people on benefits includes the word scrounger. These are people trying to take our money, take our tax money. But when we talk about people at the other end of the social scale, aren't they astute because they know how to manage the money, hide it away in overseas bank accounts, etc.? So it's perhaps out with your book and experience, but we really need to challenge this language, don't we, and get better language in there. And if you have any ideas.
So you're absolutely right. And we alluded to this in the book, actually. So austerity was accompanied, as you know, by a kind of vitriolic campaign in the media, in the tabloid media, doing exactly that. So scourgers and all the rest of it. And it became a kind of race to the bottom because the opposition party at the time, Labour, also started talking about that same way, you know, talking about we're not the party of benefits either and all this kind of thing. And it was really successful because if you look at, there's a social attitude survey and it asks questions about, you know, what your perceptions of things in the public. And if you look at people's perceptions of those who are in receipt of social security, it decreased markedly over that time. So people's views of people in social security went down enormously because that was an effective false narrative. So again, it gets back to another question earlier about the effective use of the media. And I don't mean the mainstream media, I mean kind of social media, all sorts of ways of kind of like countering that by getting the evidence out there rather than this kind of false narrative.
To close. I think we've had a good session of questions. There's a Chinese expression, if we don't change direction, we shall arrive where we are heading. Or sort of variant of in a hole, stop digging. This has been, I suspect for this audience, a surprising presentation. Even for those of us who felt familiar with the literature on inequalities in health, have maybe not kept up to speed with what's happened more recently. George Bernard Shaw, what's written without effort is read without pleasure. This hasn't been a lecture to hear with pleasure, but I think we have heard it with some admiration for how well it was put together, presenting an enormous amount of complicated information in a very accessible way and with humor. And not only doing that, but spending just as long fielding questions one after the other. So we have had a masterful presentation on a difficult topic. I heard a speaker yesterday, Robin McAlpin from the Commonweal organisation, who was bemoaning the fact that Scotland didn't seem to be having the conversations and debates that it needs now to imagine how things could be different. And perhaps this is an event which highlights that, the need for us to be thinking imaginatively about how things could be different. And it's not David's job to prescribe the treatments. I think he's done plenty with the diagnosis and with the prognosis. It's for us to imagine what the solutions are. And in a situation where so few politicians seem to have fire in their belly, and where the media is not interested, it's an uphill challenge that faces us. But in the meantime, let us thank our speaker with a paperweight, a small token of our appreciation. And please. That there is the opportunity to drown our sorrows with a glass of wine and to be convivial. We meet again on the